In your expert opinion, what interventions, whether by the government, the NGOs, or community themselves, would you recommend to be the most effective in improving healthcare delivery, particularly in rural areas?
Dapo, the truth and simple answer is any intervention, any program that does not bring healthcare closer to people, rather than forcing them to travel long distance to care, would fail. And that is the problem we've had, and we continue to have. Like, if we go back to my first response about the way, the healthcare is fragmented, you see, the federal has its own courts, the state has its own courts, the local government has its own court, right?
Yeah.
That's good in a federal system, but healthcare is a 24/7 business. It's not a politics system. It's not about voting. We don't come out every day and say, let's go and vote how many people will die because they don't access healthcare, right? So that's not a choice conversation. We need to, as a country, bring down healthcare closer to people. And part of that is, number one, structuring rural health by really being able to recognize the total number of rural that we do have in Nigeria. And I can help you with that statistics. 100 million Nigeria, meaning 50% of Nigeria, live in rural area. I'm not talking about peri-urban. I'm talking about rural, right? Live in rural, that means 50% of our population live in rural area. We need to design for that. What that means is that I talked about local government, I talked about state, right? We need to bring down primary health care to the state level, not a national business that will go and develop, procedures and SOPs and guidelines, and we launch them and we wear all of our agbada